السلام عليكم، يعطيكم العافية جميعا. معكم الدكتور عمار عزاوي، واليوم حنبدأ كورس جديد. هذا الكورس عبارة عن الريفيجن للأسئلة الممكن تجي أو الأسئلة التي أتت سابقا في اختبارات سابقة للبارت 1 سعودي بورد. Anyway, in this sessions I will explain the answers in the most updated guidelines and text box. I'm not counting in if they are taking the MCQ from the old book, it may give another answer. But anyway, this is about more than 99% of true answer will be matched in the same exams. Anyway, guys, my cut today is work hard in silence and let your success be your noise. Anyway, guys, so let's begin. In the beginning, the first question: test to diagnose specific strand DNA, specific DNA strands. Is it Western, Eastern, or North or Southern test? Those kind of question really it's not important for you as a physician, but guys, you need to know that there are a compass or it's called blotting compass. نحفظها دائما. النورث it's RR so it's RNA, and the south it's DNA. تمام. The western area is protein, and the eastern area is post translation modification. It is RNA DNA ratio anyway. تمام. It's called post translation. You're not gonna be questioned in this side, don't expect it. Like in north RNA and south is DNA, الويست بروتين. اللي بينهم حيكون مثلا ما حيجي كمان. north west is protein RNA, both of them as you see here. تمام. protein and RNA, and southern is DNA and protein, southwest. Okay. The correct answer here, of course, guys, it is the southern tests, because they're asking about the DNA. Okay, guys, let's move to the next. Breast milk reach any type of IgA. Of course, we explained that it is IgA, but what you need to know, guys, here, you need to know that IgA is dimeric and monomeric. It has two types. IgD, the monomeric, IgE also monomeric, but it's rare. IgG is monomeric also. Here it's pentameric، يعني خماسي الشكل. تمام. The IgA found in gastrointestinal بشكل عام أي mucosal area, gastrointestinal, respiratory, urogenital tract mucosa, prevent colonization by pathogens. تمام. It's present in the saliva, tears and milk على أي secretion كمان. IgDE هو اللي يعمل secondary immunity and membrane immunoglobulin. It is part of membrane receptor naive B lymphocytes. It's very rare. Sorry, I'm talking about IgD. IgD it's only a membrane immunoglobulin. IgA هذا موجود في الماست cell some platelets. It's involved in the allergy and also for parasitic processes. Its interaction with basophil and mastocyst. فالسؤال ممكن يجيكم هنا ان الاي جي اي found where in the mast cyst. ما تنسوا السؤال الجواب هذا. Also histamine, it causes histamine release. والبازوفيل cells on the other side. الاي جي جي هو الوحيد اللي يعدي البلاسنتال barriers and it form the secondary immunity. تمام. ال IgM هو it's part of the membrane receptor also of naive B lymphocytes. It's found in the serum, secreted early in acquired immunity، يعمل primary immunity. إذا كل واحد فينا له جواب معين أو سؤال معين. هذا it formed the primary immunity, secondary immunity and cross-brain barriers. هذا للالرجي and it released from the basophils, mastocysts and by the antigen triggers. IgD it's rare to be occur. هذا عندنا two phases of it, secretory and secretory and the normal one, and it is secreted through breast milk, as the question mentioned. Here are about 1 2 3 4 5 questions in one MCQ. Okay. طيب نيجي بعدها على الريبولا specific IgM appear after. الخيارات معطينا هنا هي 3 weeks 6 days 9 weeks and 10 weeks. هذا الشارت اللي يورينا الاي جي ام والاي جي دي رياكشن. تمام. طيب المهم السؤال clearly Rebola specific IgM appear after. تمام. متى يظهر؟ anyway حسب كلام ويليام IgM antibody can be detected using enzyme linked immunoassay for 4 to 5 days after onset of clinical disease, but antibody can persist for up to 6 weeks. إذا نستنتج مما ذكر إنه it will start غير اللون. It will start showing 4 to 5 days after onset of clinical disease. طيب. And up to 6 weeks. إذا none of those are there. تمام. طيب هنا IgM detected a few days after the infection. Peak 7 to 10 days. Even they're talking about days, weeks. تمام. IgM disappear 4 to 5 weeks. This is upon RCOG people. This is what's important here. Anyway. طيب. Ebola virus infection can give rise to transient low level of IgM. With this, fetal infection can rarely occur, but no adverse fetal effect has been found or described. Serum IgG antibody titer peak 1 to 2 weeks after rash appear. تمام. ال IgG يرتفع 1 to 2 weeks after rash appearance, while the IgM start few days. So none of those are correct answer. All are wrong. تمام. The answer, the true answer, it is 4 to 5 days only, or there is something missed in this question, so I mark incomplete question. Okay guys. طيب let's go to the next. طيب condyloma acuminata causative organism, whether it's human papillomavirus, syphilis, or Ebola. Of course, guys, it is a human papilloma virus. طيب طبعا الديفرنشال diagnosis الالسرز او الجينيتال ulcers, it could be chancroid, condyloma acuminata, condyloma lata. فهنا هذول الاثنين لازم تفرقوا بينهم. الفرق بينهم انه الكوندايلوما لاتا it is one of the causes of the syphilis. ممكن تجيكم في الاكزام. تمام. if they give you a question here, make sure that you know what they are asking about you. While condyloma acuminata, it's a genital, it's caused by human papillomavirus, most commonly 6 and 11 as I mentioned here. وهذه هي benign type. تمام. طيب دائما ما تنسون انه chancroid وهذا MCQ اخر, it is painful and it's one of the painful and it is non-indurated بشكل هيكون عشوائي. تمام. and it's caused by Haemophilus dorsei. تمام. الكوندايلوما acuminata it's cauliflower. ايش يعني cauliflower؟ and it's a lot. تمام. a lot of blisters and it is painless like condyloma lata. تمام. الجرانيولوما انجواني اللي نتكلم عنه اكثر, it's slow growing nodule or papule at the site of inculation that develop into beefy genital ulcer ولا lymphogranuloma venereum. It's small painless. وركزوا على كلمة painless here, the one who is painful or chancroid, and this is another MCQ. Okay guys, okay, let's go to the next. Pregnant female ask about safe vaccine in pregnancy. This is very interesting question, and you need to know what is safe for pregnant. Here the type of question: measles, BCG, rubella, and tetanus. Tetanus, measles, and rubella and BCG are all live attenuated vaccines. Okay, they are live attenuated vaccine, so they are contraindicated in pregnancy, while tetanus is a toxoids, and you need to know this. It may come as an MCQ in this schedule. I summarize for you guys what may give and what may not give to the pregnancy. For instance, in Hepatitis B and Hepatitis A, only in patients at risk. Human papillomavirus, no. Influenza, there are two types. Anyway, the one which is dominant here, it's the live attenuated, so the answer here is no, while the killed one or recombinant one, it's yes. MMR, it's live attenuated اللي هو measles, mumps and rubella, no. Meningococcal, only in endemic area if indicated, so it's not recommended. Tetanus, it's a toxoid, and diphtheria also, you can give them. Varicella, no, because it is live attenuated. تمام. It's preferred to be, of course, in TD. It's preferred to be in more than 20-week gestation, but this is still, you can still give it to a pregnant mother. Okay. طيب. Next one. Female with missed abortion had severe bleeding, received oxytocin and 60 milli-unit per mil and D5W over 14 hours. She developed seizure. What is the cause? Oh, horrible. Here, guys, you need to know what do we call it. It's the most it's the one actually that may come to the exams, اللي هو water intoxication. What is water متى يحدث؟ هو يحدث غالبا لما يكون عندنا الريت أكثر من 30 إلى 40 ملي per minute. وهنا ما أدري إيش كاتبين 60 ل 40 in D5W over 14 hours. الريت متى ما كان يوصل 30 إلى 40 ملي per minute you expect to have water intoxication. تمام. والسبب mainly في الووتر water intoxication due to vasopressin like وما قلت activity على طول activity. تمام، لأنه it is mimic the antidiuretic hormone effect. هنا الcomplication the 3 C's guys ما تنسونها: convulsion, coma, and collapse of the patient. Okay, the 3 C's ما ننساها. طيب. So the answer here easily it is the water intoxication. Anyway, let's go to the next. طيب, which of the following hormone will be found low in lactating women? طيب, LH, cortisol, insulin, and growth hormone. إذا عندنا هنا المother is lactating. تمام. It's a lactating woman, and one of those things will be low. طيب نروح عليها logic. Usually lactating women they are not ovulating. طيب what is the cause for ovulation? The cause of ovulation is LH. طيب what about the rest? Is that important? No. طيب هذه هي السايكل اللي ممكن تصير فيها. نبدأ بالsuckling at breast or regular stimulation of the areola, whatever يعني we are doing. This is will affect the hypothalamus and give negative feedback to the anterior pituitary, thus will decrease the LH, and nobody knows about the FSH effect. It will go to the ovary and it will not gonna make the patient ovulating. Get it, guys? And on the other side, it will decrease estradiol. Okay, guys, I hope it's very clear. So let's go to the next. Type. Which cell responsible about immunoglobulin production؟ سؤال صراحة يعتبر سؤال لئيم، سؤال صعب جدا. The answers was either T cell, plasma cell, macrophage, and lymphocyte. The answer here is plasma cell. In general, foreign microbes attached طبعا with antigen and enter the macrophage as you see here, and it will enter and it will process. Then after processing them, it present them to the B cell and helper T cell. The helper T cell stimulate the B cell and also the B cell on the other side. The net outcome is one. It's the two subsequent exposure to the same antigen change memory B cells اللي هي CD4 to plasma cell, and memory B cell remember the antigen. The other side here plasma cell and plasma cell, and this is what we are looking for. The plasma cell produce the antibody and immunoglobulin, and this is the correct answer. Okay. يبدأ الموضوع بالماكروفاج وينتهي للبي والتي helper cells. البي cells it will produce the plasma cell, while the T helper cell with aid with B cell تحفز لنا الميموري cell to remember the antigen again if it occurred. Okay. طيب. Next question, menorrhagia best defined at. What is menorrhagia, guys? It's heavy menses with regular bleeding. طيب. There are many other definitions here. Heavy menses with prolonged bleeding, what do we call it? Overly frequent menses with normal interval, overly heavy menses. Okay, طيب نشوف هنا. أول واحد metrorrhagia. What is metrorrhagia? It's menstrual flow at irregular interval. طيب menometrorrhagia هي irregular and excessive flow. يعني we have irregular interval اللي هو الميتورrhagia. فمينوميتورrhagia it's ما هي بس metrorrhagia, it's also heavy or excessive flow. Polymenorrhea, it's bleeding at interval of less than 21 day. This is the polymenorrhea. تمام. طيب. Post-coital bleeding is non-menstruating, non-cyclic. تحب تسميها سميها bleeding that occur immediately after sexual intercourse، وهذه أهم علامة فيه. Menorrhagia, as an exam here mentioned, it's a complaint of heavy cyclical menstrual blood flow over several consecutive menstrual cycle in a woman of reproductive years or more. تمام. فهي it has two main things. The first thing is cyclic menstrual blood flow. Cyclic. تمام. And it is heavy cyclic. So it's heavy menses with regular interval. A is the most common. Oh, it is the right question. Okay. طيب. The next one is said, which is a second phase drug metabolism? Okay, this is actually very mean question, and it is unexpected صراحة to be seen. لكن they were not gonna ask more than this, guys. Drug, it will enter the two phases. The first one is phase 1 active phase, with phase 2 inactive phase. طيب. طيب هذا هو الدراج. It will go to the phase 1. It will go to metabolite and polar species, and it will eventually after producing its effect, it will eliminate in the urine. In phase 2, it go to a drug conjugate or adducted in the liver, and this is what we are looking for. So here in general, the drug metabolism, it's phase 1 reaction oxidation, reduction hydrolysis reaction, and phase 2 conjugation by those things and drug metabolism. The rest is not that important guys. If you need to read it you can read it. لكن الام سي كيو ممكن تجيك هي active inactive conjugation. تمام. There are enzymes induction and inhibition also. This may come as MCQ by cytochrome P45 if you need to know this. Okay. Anyway, let's go to the next type. Female 8 weeks amenorrhea complain of PV bleeding if lower abdominal pain. Anyway, ultrasound show thick endometrium lift. This is lift, I guess. Lift or lower abdominal pain. Anyway, تمام. Thick endometrium lift adnexal mass. What is the most common? The MCQ, the answers was is either isthmus, impella, fimbria, ostium. This is a clear picture. 8 weeks of amenorrhea, pain. It's left lower abdominal pain or lower abdominal pain. Anyway, if you see amenorrhea with pain, pain is 100% sensitive to ectopic pregnancy. There is thick endometrium and there is a sac. So, and some bleeding. Okay, so this is mostly, it's an ectopic. The most common sites in ectopic in fallopian tube, it's ampulla. It's ampulla. طيب, in ampulla, it's account about 80% to be present. تمام, because it is the most wider side. طبعا الانفندibulum هو أكبر منه, لكن over 70 or 90% of those infants are not detected clinically and they can manage expectantly. The ampullary one is the one which is mainly could occur. It may occur in others rare area اللي هو مثل ovary and abdomen and the cervix. طيب خلينا نتكلم على الاوفري. الاوفري لها كريتيريا محدده وممكن تجيكم في الاختبار اللي هي يسمونها Spiegelberg criteria. The tube on the affected side must be intact. The fetal sac must occupy the position of the ovary. The ovary must be connected to the uterus by the ovarian ligament. Definite ovarian tissue must be found in the sac wall. طيب بالنسبة تحفظوا الاسم, you need to know the characters of them. It may come for you. What is the character of Spiegelberg criteria? You know it's an ovarian ectopic. طيب Robin criteria, it's the cervical one. There should be, وهذه أهم نقطة, cervical gland opposite to the placental attachment. تمام. الثاني attachment of placenta to cervix should be below the entrance of uterine vessel or below the peritoneal reflection. Fetal element should not be present in the corpus uteri. تمام. الالتراساوند criteria أهم واحد هو hourglass shape of the uterus. Okay guys, so let's go to the next. طيب, shape of the anterior fontanelle. Is it oval, round, diamond, or triangular? The answer it is diamond as we see here. طبعا زمان كانوا يقولوا oval, ما ادري ايش غيروهم الدياموند, ما يهمنا. diamond لكن السجدة السويش ممكن تكون عندنا واحدة هنا إذا ممكن يذكروها لكم برضو. It is diamond and it is found mainly in Down syndrome. This is MCQ. In general, we have 6 fontanelles in the baby. واحدة anterior fontanelle اثنين سفينويد واثنين ماستويد صاروا خمسة، والسادسة it's the posterior fontanelle اللي منظرها triangular. تمام. So مبسط الموضوع أن ال posterior fontanelle it's triangular, anterior fontanelle it's diamond. In general we have 6 fontanelle. if it come to MCQ هذه صار عندنا حدود 4 MCQات هنا. تمام. حاولوا guys انكم ما تنسونها. تمام. طيب let's go to the next. Two doctor in general cafeteria, and I'll talk about one patient by his name and specific diagnosis. What type of patient right was violence, privacy, autonomy, confidentiality and justice. طيب يهمنا نعرف كل واحدة فيهم. السؤال هذا صراحة غريب شوي. تمام. Because privacy and confidentiality قريبة جدا على بعض and it's related to each other. لكن يهمنا بشكل عام نعرف تعريف كل واحدة. What is autonomy in general? It's respect of individual. تمام. Respect of individual autonomy or ability to make decision for him or herself. يعني هذه مثلا patient has in the stage renal disease. No, أو stage advanced stage of cervical cancer, and the options is to give her palliative chemotherapy. The patient pick not to take this medication and she accept to die earlier. This is autonomy of the patient. It's patient right. We can't do anything. Another example, patients on labor ward and baby start developing bradycardia, but the patient refusing to go for cesarean section after full explanation that this baby may go into cerebral palsy, may die, may be severely affected after delivery, but refused so. Then the autonomy of the patient, you have to respect that. نحترم هذا الشيء. You can't change anything. What is justice? Justice refers to the need to treat all people equally fairly. مسيحي، يهودي، مسلم، كافر، أبيض، أسود، ما يهمنا. كأطباء we will treat them. ما نسأل والله في eligibility ولا ما في eligibility. ما نسأل عن أي حاجة. Just treat them at the best level of care. تمام. Beneficence is this refers to the tradition of acting always the patient best interest to maximize the benefit and minimize the harm. يعني I'm going to do a cesarean section or whatever, or hysterectomy, subtotal or total. I won't keep a pedicle because this is maybe a risk for a patient to develop cervical cancer because she is high risk to develop so I need to remove all the cervix. You got it guys. يعني اشتغل على مصلحة المريض القصوى. ما اقول يلا هذه اسهل اسوي الاسهل او هذه ارخص اسوي الارخص. No. مصلحة المريض القصوى. Non-malfeasance, the principle ensure that the treatment or research taken not to produce harm. وهذه غالبا تكون بالproject research project والexploratory laparotomy. And once I open the patient's tummy or I'm doing research, I'm not gonna do something would harm the patients. Okay. Regarding to this scenario, those doctors really violate the confidentiality of the patient's confidentiality. It means that the information the patient has to write to not known his name, not known his nationality, his color, and his illness. You can speak about the illness at like any other illnesses, but it's not. It's really violent to confidentiality if you talk about the doctor's name and the patient name. مثل ما يحدث كثير في مستشفياتنا. The first thing you ask about, oh, a doctor develop a patient come back with the post-cesarean section and she developed uh, wound infection. The first question that may ask, who was the doctor? It's not doctor's fault. Please, guys, it is related to the standards of the hospital, of the policies. Are they well applied? It's related to the patient also. Only 5% or less related to the doctor. So please, guys, uh, I want you all to know what is confidentiality and apply it in your career life. Tamam? Let's go to the next question. Okay. Patient right has four principles اللي هما the duty provide for fair access and benefit of intervention. Which one is true? أعطونا هنا ثلاثة أمثلة: justice, confidentiality and benefits. Anyway, the four principles to resolve ethical problem is benefits, non-malfeasance, autonomy and justice. The four I have mentioned. The one that is not related to them, it is confidentiality. Okay, so I believe confidentiality is the correct answer here, but this question is still incomplete. Okay, guys, so let's go to the next. طيب, when you join a surgery of consent already done, there is a consent, what you will do. تمام. طيب, الخيارات: the consent must be taken in surgery, stop surgery if consent not done as usual, informed relative to sign it after complete surgery, incomplete surgery without informed patient or relatives. طيب, should the consent taken in surgery and you just join السيرجري؟ هنا السؤال هذا غير واضح نهائيا. طيب, first of all, the consent has to be given to the patient with full explanation of risk and benefits and everything. تمام. Second question, it's not allowed to anybody other than the patient himself or herself, and we are talking about females, to sign on her body. She has the right to know what is going and what is going to happen in her body. تمام. So I don't know about the scenario here, لكن if the scenario say that you join a surgery معينة for cesarean section, for instance, you found out there is an ovarian cyst, simple ovarian cyst, and you want the doctor asking you to remove it, here you need to stop the surgery if consent not done as usual. طيب, هذا خيار. طيب, the consent must be taken in surgery لو ذكروا انه the patient is aware about the case, explained full, everything is known to the patient, and she is not in the OR تمام before going to the OR. So here you can pick the answer. The consent must be taken in surgery. طيب, informed relative or sign or the court or the doctor himself, this is an emergency situation. تمام. You can do it, or if there is a mental illness or limited capacity of the patient. تمام. Complete surgery without informed patient or relative, this is the most common wrong answer. تمام. وهذه جريمة طبية. لكن guys, I want to assure you that whatever consent you put here, and if a complication happened, you would go to the court as a criminal. Anyway, this question is incomplete. I explained to you when the consent must be taken in surgery and when to stop the surgery and when the informed relative to sign it after complete. Sir, no, not after complete surgery. Sorry, guys, this is also wrong. It's before it has to be before. تمام. So it is one of the two things. Upon this scenario, I'm assuming that stop the surgery. This is the right answer in this not complete scenario. Okay, guys? So let's go to the next. طيب. A pregnant 38 weeks complain of dizziness when on supine decrease in lateral position. What is the cause? The cause, it's easy, لكن also guys be aware because it's compression of the major vessels. It's not only the inferior vena cava compression. تمام. It's not related to heavy meals or abdominal gases. So this is why the patient, as you see here, this is the aorta, the inferior vena cava and the aorta, both are compressed by the fetus or the gravid uterus, and you need to lay down a little bit left or right, and left is better, and to relieve that, so the patient won't feel that dizziness and won't suffer. Okay, very easy question. طيب, a female at term with mitral stenosis, best plan for delivery. She has mitral stenosis. Is it elective CS? Is it to prepare for second stage possible instrumental delivery? Is it a prophylactic antibiotic? Is it vaginal delivery plus antibiotic if instrumental used? Here we are to speak about some MCQs. طيب, أول حاجة you need to know. أول حاجة خلينا نكتبها كذا must. خلينا نصغر الخط شوي. wait a minute guys. okay. okay. طيب, must valvular disease are acquired. هذا أول MCQ. تمام. acquired بإيش؟ بالrheumatic heart disease. طيب, وهذه it will cause mitral stenosis. إذا they are talking about something common. شكرا لكم. Because you mentioned the common. Then I need to know what is the common so I'll be able to answer it. تمام. الباتient ممكن تكون symptomatic because of this mitral stenosis. صح؟ dizziness, cyanosis, whatever. So the treatment is diuretics, beta blockers, mainly propranolol. تمام. لو حصل لها atrial fibrillation, you may give her Verampiel. تمام. ما المهم الدوز لكم. Electrocardioversion may be in chronic cases. Digoxin, beta blocker, calcium can be given. تمام. طيب, اللي يهمنا الدليفري. in delivery. طيب, uterine contraction increase cardiac output by increasing circulation blood volume. pain, exertion, and anxiety تسوي كمان tachycardia with possible rate related heart failure. تمام. So what you should do أول حاجة epidural analgesia عشان تخفف الألم for labor. تمام. هذه أول نقطة. But fluid overload should be avoided. ثاني حاجة fluid overload should be avoided. طيب, ممتاز جدا. طيب, must prefer route is vaginal delivery. تمام. In women with mitral stenosis. What is the contraindication? It is always methotrexate. تمام. Even here we have about 5 to 6 MCQs in one MCQs. تمام. So your aim here is not elective cesarean section. Prophylactic antibiotic and vaginal delivery. This is not an indication at all. Vaginal delivery and antibiotic, if instrumental use, yeah, unlikely. And prepare for second stage, possible. It's not really necessary. Instrumental delivery. Tamam? Very clear and easy. I hope you understand the whole MCQs. Okay, the next one. It's a gravity 3 para 2, 41 weeks. تمام plus 3 days previous CS due to fail of progress. تمام followed by normal vaginal delivery. Bishop score is 3. بس تخيل البشب score is 3. What is the best management? تمام So 3 is considered very low in bishop score. You need to know, hi guys, before going into the answer choices, تمام, what is the interpretation of bishop score? Bishop score إذا كان من 0 إلى 4, this is unfavorable cervix. It's associated with failure, prolonged labor, and high incidence of cesarean section. If it is 5 to 8, this is cervix is moderately favorable. 9 to 13, cervix is right. And you expect very outcome in delivery. طيب. So هذه المريضة المسكينة, she has a previous CS, تمام, due to fail to progress. Should I take her to cesarean section? No, this is not an indication. تمام. The best indicator for cephaloperfunctus proption is another trials. تمام. زمان كانوا يقولوا حجم والسايز واكس راي وام ار اي. No, it's another trial. تمام. But they excluded لغوها لما قالوا followed by normal vaginal delivery. تمام. So bishop score is 3. You need to induce the patient. They give you a horrible things. The bishop score is 3. تمام. And 0 to 4, it's unfavorable cervix. Here, the best management to is to wrap the cervix either with prostaglandins or with mechanical tent or catheter. According to ECOG people, they don't like mechanical tent, and it's still under studies, and they are making a lot of studies. It's not promising. RCOG people recommend a mechanical tent or catheter, balloon catheter, or Foley catheter, whatever to it. It's the right answer here because this question taken from RCOG people. تمام? CS, no, I wouldn't choose it, but it depends on the scenario. تمام. If the scenario mentioned any criteria to take the patient to cesarean section, I would take her. Misoprostol, this is absolute contraindication, the most common wrong answer. تمام. So it is not recommended. Okay, so let's go to the next. A primary gravida at 41 weeks admitted for cervical ripening. Best method. Okay, she's 41 weeks. She's post-dated. تمام. She's primary and she admitted for in cervical ripening. What is the best? Is it mechanical? It's prostaglandin, extra. Actually, still prostaglandin is the best use in non-previous scar. There is no type superior to other type of prostaglandin. يعني ما حد يقول لك tabs ولا gel ولا insert ولا whatever it is all the same. No one is superior into the other. لكن still prostaglandin is the best use in non-previous scars. Okay, guys. So the answer here is prostaglandin E2. Let's go, guys, to the next. طيب. At 1 primary gravida 37 weeks with decreased fetal movement, CTG for 30 minutes, I guess, non-reactive. Next step. This is really incomplete question. تمام. Is that 30 minute or not? I don't know. uh, it is non-reactive. Mm, Anyway, the question answer is here is biophysical profile, repeat CTG after 1 week, CS or induction of labor. I would assume this is wrong and the CTG is reactive. This is incomplete question again, and I will assume if the CTG is non-reactive. If the CTG is not reactive, I would give the CTG, it depends on the category 1, 2, or 3. In 3, I would take it for cesarean section. In 2, I would wait for 40 to 70 minutes, and I would support the patient with good hydration and oxygen on her left lateral side to see if there is any abnormality. If it is reactive, I would do what I'm going to do now. And that main complaint decreased fetal movement. And we put her in CTG and we found it reactive, for example. So what should I do? Biophysical profile, repeat stress CTG after 1 week, CS or induction of labor. Okay, in this scenario, the best response to know if the for fetal surveillance is the biophysical profile. طيب ايش هو البيوفيزيكال بروفايل؟ بيوفيزيكال بروفايل احنا نشوف مجموعة عوامل تمام and we summarize it نعطي صفر if none 2 if there is تمام 5 عوامل رئيسية تمام if we got 10 it means this is normal ال 8 تحتمل قسمة if there is oligohydramnios here it's deliver more than 37 weeks وركزوا في السيناريو هنا تمام if they said there is oligohydramnios and biophysical profile 8 out of 10 deliver the patient if there is nothing if there is no oligohydramnios is no fetal indication for intervention repeat test per protocol 6 there is possible asphyxia and in 0 to 2 almost asphyxia here you have to deliver and 6 here it depends if on amniotic fluid volume تمام if normal deliver more than 36 if less repeated أقل من 6 deliver more than 6 observe as per protocol and deliver more than 36 if it's for repeat tests in the same day ركز يعني تجيكم MCQ هذه كثير تمام and if still less than 6 deliver the patient تمام biophysical profile is very important in your career تمام we have 5 components for it it's the amniotic fluid index breathing movement CTG flexion or extension of the baby inflection position تمام هذه هي الكريتيريا للبيبي it has to be done within 30 minutes تمام there is modified by physical profile it has 2 components اللي هما amniotic fluid volume and the CTG it is semi-equal to biophysical profile but it's not like it okay لكن يهمكم انكم تعرفونها let's go to the next طيب a pregnant ask about best single test for fetal well-being تمام is it non-stress test Doppler velocity contraction CTG no single test actually it is you need to know that all of them are screening لكن the most accurate if we can say is biophysical profile since it is not available here none of them is good so also the question here is not complete if they mention the baby is FGR or IUGR then Doppler velocity or anemic or hydrops then Doppler may be an indication Non-stress CTG is not that sensitive, not that specific, but it's a good unlimited screening tool. Contraction CTG used previously in the past either by nipple stimulation or oxytocin, and it is used to see if the patient can go for normal vaginal delivery. Anyway, from those I will pick no single test and I will send her the correct answer here. Okay, so let's go to the next. A female in postpartum period on amoxicillin and clindamycin postpartum. تمام, complain of abdominal cramp, diarrhea and stool analysis show exotoxin. يا سلام, bacteria. What is the best management? قبل ما نروح في البست management, what is the cause? The cause simply is, it is C. difficile or Clostridium difficile. What do you know about Clostridium difficile? هذا السؤال ممكن يجيكم. It's gram positive. تمام, motile. تمام, it's produce exotoxins. And it is occurred due to prolonged use of لا ما نقول oral antibiotics و general antibiotics in general such as clindamycin treated by either metronidazole or vancomycin. ركزوا هنا orally. الفانكومايسين usually giving IV لأنه it has very low absorption effect. هنا نعطيه orally بالفانكومايسين. Okay, so what's the best management? طبعا the best management here is to give the patient the metronidazole. تمام? Not to stop the medication, and we have actually you have to stop the medications and switch it to other one. لكن هم سؤالهم best management. يعني they are not clear actually. لو قالوا next, I would think of about stopping the medication and starting metronidazole, but the best here is metronidazole. إن شاء الله يكون هذا الجواب الصحيح here, but stop medication is right. Metronidazole. Stop amoxicillin, no, amoxicillin wouldn't cause that much, and continue some medication only, no. Okay, so this is it. Let's go to the next. طيب. Hematocrit is, what is hematocrit? Is it hemoglobin concentration in blood volume, hemoglobin in blood in RBC, hemoglobin concentration in RBCs, or RBCs concentration in blood volume? What is hematocrit? Hematocrit is the ratio of the volume occupied by the RBCs to the volume of whole blood. So this is the hematocrit. طيب, let's define some definitions, وهذه ممكن كلها تجينا في الاختبار مجموعة MCQs. أول شيء إيش هو MCV? It is the volume of average RBC. تمام. Oh, very nice. تمام. إذا هو الحجم الطبيعي عندنا تمام من 80 إلى 100 FL. تمام. طيب, ال MCH, إيش هو ال MCH? It is mean concentration of hemoglobin in each RBCs. يا سلام. طيب, هنا يجي لنا سؤال ثاني. MCHC, what is it? It is hemoglobin. تمام. present per 100 milli of RBC, يعني الافريج. تمام. غالبا اثنين هذولا لازم يكونوا حدود 30 جرام. تمام, او 30 بايكوجرام, 30 بيكوجرام, وتحول الى 30 جرام per 100 ml. اوكي طيب خلصنا هذولا. آخر واحد ممكن يجي في الاختبار، هذولا 1 2 3 4 صرنا مع الهيماتوكريت. الخامس اللي هو red distribution width. تمام. It is a measure of variability of erythrocyte size. Here guys, I hope it is. تمام. طيب in menopause, selective estrogen receptor medication for selective estrogen receptor medication for. What those selective estrogen receptor medication used for? Is it used for osteoporosis, vasomotor, psychiatric, or high level decrease high level effect of on endometrium? I don't know what is this. لكن in general selective estrogen receptor medication with the most common of them is raloxifene, is used to decrease the osteoporosis. Okay, so this is the correct answer. طيب هنا نتكلم بشكل عام عن الرالوكسيفين. What do you know guys about raloxifene؟ وعندنا alternatives. It's a selective estrogen receptor. It acts as estrogen agonist on bone. يا سلام، عشان كده نحبه. And antagonist on breast and uterus. يعني it won't cause breast cancer, it won't cause endometrial hyperplasia. It's approved for prevention and treatment of postmenopausal osteoporosis. هذه معلومة كمان ممكن أذكرها لكم. Side effect of this medication. What is the side effect? Hot flush mainly. تمام. نجمعها كمان. تمام. Also venous thromboembolism and little bit leg cramp. Not that important. Okay. This is it. So let's go to the next. Maximum hour of sperm life in uterus. Is it 48? Is it 72? It is 96? Is 110? This is really difficult and complicated. تمام. لكن no one sit on a study that is real. Like this question is coming regularly. It's found in Aurora, I guess. And the most common question here, the answer here is 72. لكن يهمك also to know the parameters of normal sperms here. The semen, it should be 1.5. Sperm concentration should be more than 15 million per ml. Total number more than 39. Mortality more than 40%. Progressive mortality more than 32. And normal for more than 4%. They may ask you in any of those parameters, guys. Be prepared to answer them. تمام. The maximum hours of sperm is 72 hours. Okay. طيب. Next is in menopause. No, this is not the next. This is the former one. طيب. Which progesterone has the most androgenic effect? طبعا دائما هذا السؤال it come routinely to the exam question. الخيارات هنا نورجسترول، وخلينا نلون النورجسترول وهذا هو النورجستريل. تمام. الخيار الثاني ليفوجستريل وهذا هو الليفوجستريل. الخيار الثالث نورثندرون and this is the northindrone. والخيار الأخير northern acetate, and this is the northern acetate. طيب in general نحط general rule guys. الفيرست تمام الاستروجينيك بروجستريك and androgenic. الاستروجينيك يكون أقل، البروجستريك يكون قليل، والاندروجينيك يكون أقوى. السكند جنريشن under البروجستيرون effect والاندروجين effect is very strong. A third the uh, progesterone and estrogen effect is very good. The fourth, it has anti-androgenic effect. anti-androgenic effect مثال على ذلك drospirenol ممكن يجيكم as an MCQ question what is that thing. تمام drospirenol and also sapropteron. طيب second generation, it has very potent progestational effects and also تمام it has very androgenic effect. عشان كذا it is recommended to give locally وهذا هو what do we call it the marina. تمام and this is the marina. تمام sorry and this is the marina. طيب northern drone اللي يجي مع الجنارة norgestrel dydrogestrel, this all has some estrogenic, some progestational effect and androgenic effect. تمام. And fourth, it is the best recommended in cases of PCO. تمام. Of course, in hirsutism, it is really recommended. Desogestrel also. Uh, um, also, what I want to mention is the VTE effect. Actually, ال VTE تكون أقوى بالفirst وتقل بالتدريج، لكن they said it is also sorry تكون قليلة في الفirst وتزيد بالfourth. They said it is more in the fourth generation. And Yasmin, for instance, it holds sapropteron and norgestrel. It is not FDA approved anymore and it's not recommended because of high risk of BTE. يا جماعة, this medication is still in our market. We need to stop prescribe it and stop people using it. Okay? It is risky for VTE. Anyway, the answer here, so it is the levonorgestrel. Let's go to the next. طيب, which precursor of estrogen and obese. السؤال ايش هو البريكوزر للاستروجين in obese woman. طيب ما ادري ايش يبغون بصراحة. The precursor of estrogen is always progesterone وبروجنينون، لكن هذه الخيارات غير موجودة هنا. الاندروستريديون it will change to estrogen in obese and non-obese. الاسترون it form and it change to estradiol also. estradiol هذا it found in a pregnancy. I don't know what they want here، لكن I would pick تمام I would pick estradiol. ليش؟ I won't pick estron. ليش؟ لأنه they did not mention if it is in reproductive or in non-reproductive. This is the first thing. The second thing اللي هقوله nobody mentioned that estrogen increase with obese women more than estradiol in reproductive age group. الشيء الثالث اللي هذكره if the patient is postmenopausal or in the 50s or 60s, yes, estrogen is dominant. آخر حاجة estriol is found, it's a placental hormone. It signs from placenta and it's not related to that. Androstenedione is synthesized in granulosa cell to form estradiol. So I don't know what they want. I will pick estradiol here based on what it's mentioned. In general, guys, I have mentioned that for you, the estrogen effect, estradiol and estriol. Also, I need to tell you that estradiol is known as 17 beta estradiol. This is the principal estrogen in premenopausal and reproductive age group. استرون تقريبا ثلث the estrogenic potency of estradiol يحتوي طبعا على ثلث قوة الاستراديول الطبيعي. Primary circulating estrogen after menopause. Estriol is significantly less potent than estradiol because it's principal estrogen produced by the placenta. واضح يا شباب؟ So don't be masked by obese and read the scenario carefully. My answer is estradiol. طيب. The primary syphilis. Primary syphilis, is it painful, Chanker? Is it painless? And is there a giant cell in ground of ulcer, polymorph cell and red base of ulcer? Of course it's not painful, Chanker, لأنه هيكون اسمه بهذاك الوقت chancroid. تمام? It's painless and there is painless lymphadenopathy and lymph node. تمام؟ اللي يهمني هنا تعرفونه is stages are primary, secondary, latent, and tertiary. In primary, it's 3 to 4 weeks, painless chancre at inculation site. Secondary is 4 to 8 weeks, and condyloma lata and some systemic symptoms like rash appearance would be there. Latent, it has early, less than 1 year after infection, and more than 1 year. Usually this is asymptomatic period. The tertiary يحدث فيها مصايب الدنيا كلها. Gommatous lesion, arthritis, coronary arthritis, CNS, dorsalis, tibialis, and paracesis. Everything would happen there. النهاية وخيمة للأسف. Still, this disease is 100% sensitive to benzathine penicillin. 100% sensitive. تمام؟ الله يديم الsensitivity حقته. طيب. Let's go to the next. Epidermal growth factor action. Increase insulin growth factor. I don't know, this is incomplete question. لكن endodermal growth factor play an important role in controlling normal cell growth. تمام؟ Apoptosis and other cellular function. Activation of the receptor is also important for innate immunity response in human skin. تمام؟ في عندنا يتحكم بيدرمال جروث فاكتور بالنمو وبالابوبتوسيس اللي هو programmed cell death. تمام؟ and some of the cellular function. تمام؟ وتلعب دور مهم جدا بالinnate immune response in human skin. Okay? Let's go to the next. طيب. A drug not lead to cure but prevent death. يعني حدث الدواء حدث المرض هذا فحدث لنا incidence. مثال على ذلك SLE، فعندنا صار SLE، فاحنا we give a medication to prevent mortality, to elevate the symptoms. Still disease here. So what would increase the prevalence? يا سلام. طيب. prevalence هنا نعرف شوية تعريف. Prevalence is how many cases are there in the same time. So if you have a medication that prevent or delay death and not cure the patient like chemo and radiotherapy, then those medication would increase the prevalence. Incidence is the study how many cases occur during certain period of time. Okay? Incidence It's show how many disease occur in the community, and if the drug is cure the patient, it will decrease the prevalence. If it cure the patient, if the medication not curing the patient, it will decrease incidence, decrease of increase prevalence. If there is a vaccine, it will decrease incidence. If there is a medication or food or exposure to something would lead to something, it will increase the incidence. Clear guys? Inshallah ya Rab. طيب. Primitive fetal circulation established after ovulation on day. Okay. طيب. كيف اكتب لكم هنا؟ خلينا نتكلم معلومات كذا عامة نراجعها أنا وياكم and we discuss it almost all of them. The first heart beats. كذا هتكلم عن the first heart beat. طيب. By the day 21 the primitive والMCQ طبعا primitive heart start the first beat. طيب واحد يقول لي ليش ما اختاريت؟ أقول له يا أخي هنا نتكلم عن fetal circulation. I'm talking about the primitive heart. طيب by the 28th خليني كذا أحطها day the circulation begin in the blood vessels. طيب طبعا the primitive heart has 4 chamber. خليني اكتبها هنا عشان ما تنسون. It has عفوا 5 chambers. It's not 4 chambers. تمام. اللي هم طبعا لهم اسماء مختلفة جدا. It's not important لكن I will mention it briefly. It's truncus arteriosus, bulbus cordis, primitive ventricle, primitive atrium, and sinus venosum or venosus. Sorry. هذول هم. It's not that important for you guys. عرفوا انها 5 chamber. The heart start at 21 days والcirculation start باليوم 28. بس هذا تحتاجونه. Those are 3 MCQ questions. You don't need more than them. Okay, let's go to the next. Range. Range. Oh, range. Range is غضب. Range is of sample. Of this sample, how we calculate it? We calculate it simply by taking the minimum one and maximum one نطرحهم من بعض. The result is 12. طيب لو قلنا لكم اعطونا المود هو الماست repeated results هم 87. لو قلت اعطوني الميديان اللي هو الميدل النمبر 1 2 3 4 5 it is also 87. او اخر حاجه اعطوني المين هو مجموع كل هذول على عدهم 1 2 3 4 5 على 5. تمام. فهو مجموعهم على 5 يطلع كم هو المين. كذا عرفتم what is the mood, what's the range, what's the medium, what's the mean. If they bring you a question at this type area of field of exam of questions, this would be very easy. طيب. Next, must cardiac anomaly if exposed to teratogenic toxin on weak. الكلام حددوه and they are very specific about cardiac anomaly. تمام. And they had teratogenic toxins. طيب نشوف هنا it will mainly be in 7 and 8 questions. So the answer is simply 7 to 8. طيب if they mention the central nervous system, it will start from 6 up to the term, heart 7 or 7 to 8, ear 9 to 16, limb is 8 weeks, eye from the beginning of 9 weeks, teeth from the beginning of 9 weeks, platelet 9 weeks, external genitalia beyond 9 weeks. تمام. بيتكلموا عن الكارديك انومالي. ايزي اتس ذا اونلي وان اللي هو 7 ل 8 اسابيع. الاغلب كلها من بعد 9 اسابيع. احفظوها بالشكل هذا. عندكم كارديك 7 ل 8. anything other than cardiac is 9 to 10. تمام. ما حيسألونكم anyway إلا عن الكارديك in this field. طيب. X-linked disease. ايش هو الاكس linked disease؟ فان وول براون، روتينا بيجمنتوزا، هيموفيليا and muscle ديتشين أو ديتشين dystrophy. هنا للأسف this is incomplete question and none of them is X-linked. تمام. ممكن الهيموفيليا لكن not all of them. I would pick it here لكن it won't be clear. طيب. Anyway, example for genital X-linked recessive diseases عندك red and green color blindness. تمام. هذه يسمونها طبعا بالأوبسين جينز أو daltonisms اللي هو red and green X-linked recessive وتركزوا على recessive. تمام. اكس لينكد مع منتال ريتارديشن. عندنا اهم واحد الفراجايل اكس ويجي مع منتال ريتارديشن وهذا ام سي كيو الثالث هنا. تمام. اكس لينكد مع ماسكول ديستروفي هذا دوتشين وبكر طبعا يجي لكن لس كمالي لكن دوتشين ميلي وهذا الام سي كيو الرابع. X-linked coagulation it's the hemophilia A and B and A is deficiency of factor 8 and B factor 9. طيب لما نتكلم على X-linked dominant اللي هي hypophosphatemic rickets أو vitamin D resistant lytics. So here I will pick hemophilia. Some of the hemophilia are autosomal also. You have to know that guy also. Okay. So retina pigmentosa is autosomal dominant. كمان هنا I don't know if they mean by muscle gene this one or not. So we have two X-linked. I don't know if they want dominant or if they want. This is not clear question at all. ما هو واضح. لكن إذا حفظتم الموجود هنا it will be fair enough for you guys at least for the exam. تمام. طيب. Next, crystal of rank found in. ما أبغى أطول لكم المواضيع هنا لكن it's found in lighting tumor. تمام. granulosa cell tumor it's increased by found as increase of estrogen inhibin A and inhibin B and it is occur in young ages. تمام. Brenner tumor, it's like Rockenberg and signet cell may be found on histopathology. It's bilateral tumors. Papillary tumor found mainly on epithelial tumor, mainly serous. تمام. Anyway, crystal of rank, it's enlightening tumor. This is what you have to know. طيب, most adnexal mass in adolescence. سؤال لئيم جدا. Major teratoma, of course, it's an adnexal mass and cystadenoma and dysteronoma. لكن functional follicular cysts is the most common thing. دائما if you ask you about most common and you found malignant or abnormal and normal, go for the functional and the normal one. This germinoma, it's found in the late ages maybe and it associated with increase of LDH. تمام. major teratoma ممكن أي شيء يزداد فيها mainly alpha beta protein. تمام. ممكن نلاقي فيها hair ممكن نلاقي فيها teeth everything can be found there. تمام. next. A primary gravid term by physical profile 10 ما شاء تبارك الله. How much the incidence of cerebral palsy? It's very rare, about 3 in 100,000. 3 in 100,000. No need to know more than this information. طيب. Some mama body found in papillary cancer. تمام. papillary cancer. تمام. Mm, يعني coffee bean found in granulosa, signet cell found in Krakenberg tumor and metastatic tumor. There are a lot of those things. You need to read it, guys. Please go and review the histopathology of each tumor and what it may be found there. For instance, signet cell, as I mentioned, تمام, and Krokenberg إن شاء الله نكتبها صح, tumor والميتاستاتيك tumor, coffee bean nuclei found in granulosa cell tumor. تمام. So I hope you got them. طيب, next is a gravity 2 para 1 term with active labor and 3 to 4 cm. So أول حاجة نحددها هنا, it is active labor, 3 to 4 contractions in 10 minutes. Very good one. PV examination. Absent membrane clear like represented part you felt frontal bone, orbital edge and eye. على طول أول ما يقول لك هذا الcombination you will say it is bro presentation. But it is like this, almost like this. He felt the frontal bone, eye, bone, orbital edge. This is the area that felt on that. يدوب باين هنا لو تلاحظون. This is bro presentation. تمام. It depends on the degree of flexion. Complete flexion, this is called sensipot, and moderate is vertex. Poor is flexion is brow, and full extension is base presentation. لكن اللي ابغاكم تعرفون انه most of the pro presentation what don't won't stay at the same. Either it will go for base presentation or end up in vertex presentation, because the head is movable at that area and it can change significantly. Okay, let's go to the next. Meyer-Rokitansky-Custer-Hauser syndrome, associated mostly with abnormal breast, abnormal sex, hair and urinary system abnormalities, or abnormal external genitalia. The answer here is urinary system anomalies. تمام؟ طيب. In general, in MRKH syndrome, the vagina is absent or very short. مثل ما احنا شايفين في الصورة هذه. تمام. The uterus is very small or missing also, أو ممكن يكون redundant, فعلا ممكن يكون تلاحظ إنه صغير أو مختفي أو whatever it is. تمام. However, the external genitalia, the ovaries, the fallopian tube موجودات كلهم. Sign of puberty مثل development of pubic hair وبريست ما تتأثر نهائيا وتكون كمان موجودة. The first sign of this syndrome is failure to menstruate. تقريبا بعد بالعمر 15 إلى 18 سنة. Women who have this syndrome are carry the pregnancy. تمام. The first successful uterine transplant occurred in Sweden طبعا كان عام 2014 لو انتم مهتمين بهذا الكلام. But this procedure is still considered experimental لأن أول ما once they delivered the baby they took the uterus out and they did hysterectomy to the mother, but the outcome was very good. But it's only for one uterus. Many women with MRKH undergo serial dilatation of surgery to create vagina for intercourse. MRKH syndrome is linked to other health conditions such as hearing loss, malformed absent kidney, or low back problem. إذا ممكن يكون عندنا hearing loss, ممكن يكون عندنا malformation or absence on the kidney and lower back problem. So here mainly you have urinary system anomalies. Otherwise, its breast is not affected. 6 hair is normal and abnormal external genitalia. Okay, guys, let's go to the next. Must coagulopathy in female and obstetric complication occur in protein S, antitrypsin, von Willebrand, or DIC? Of course, the answer here is von Willebrand disease. تمام? It is the most common. تمام? Coagulopathy, also called clotting and bleeding disorder, is a condition in which the blood's ability to clot is impaired. The term also covers the thrombotic state. And because of the complexity of hemostatic pathway, these two conditions can exist simultaneously. تمام؟ طيب الفون والبراند ديزيز هو autosomal dominant. تمام؟ غالبا يترافق مع prolonged bleeding time, normal platelet function, prolonged PTT, لكن not always. لكن it's actually three types. PTT will be prolonged in type 3. Diagnosis for von Willebrand, وهذا MCQ كمان, by quantitative assay of von Willebrand factor antigen. زمان كانوا يقولوا prolonged bleeding time, لكن it is a screening. I can start it to know if I have to search for von Willebrand disease. لكن diagnostic is quantitative assay of von Willebrand factor. The treatment by giving her the desmopressin. تمام. وهذا غالبا بالتايب 1 والتايب 2. cryoprecipitate it by be given and factor 8. Okay, guys, let's go to the next. Must common coagulopathy in a woman lead to bleed and need frequent transplation? What is the most common coagulopathy? تمام. It is of course a thrombocytopenia. You're not transfusing platelets, you're giving only blood. It's not fresh blood, it's only blood. So there is a significant decrease in coagulation factor, and this will lead to thrombocytopenia and maybe even DIC. Okay, guys? طيب 19 years old complain of recurrent abdominal pain, primary amenorrhea, normal developed secondary sexual characteristics. تمام؟ طيب what is this? Again, recurrent abdominal pain, primary amenorrhea, normally developed secondary sexual. ايش هما secondary sexual? Breast and hair. طيب what would be this? تمام. Is it Mullerian? Is it gonadal? Is it true hermaphroditism, which is not mentioned anymore? Congenital adrenal hyperplasia. Of course, the answer here is Mullerian agenesis in a form of imperforated hymen or transverse septum defect. So evaluation should be in Mullerian agenesis, normal breast development, normal secondary sexual characteristics, normal karyotype XX, normal LH and FSH, pelvic exam, normal external genitalia, absence of internal midline structure. أو يعني this is what could be happen. تمام. Anyway, primary amenorrhea, تمام, classified based on the following. تمام. It could be breast, there is breast and absent uterus, عفوا breast absent and uterus present، وهذه معناتها gonadal failure مثل Turner syndrome، مثل الابنورمال اكس او الشورت اكس syndrome، و insufficient GnRH, inadequate GnRH، mumps and encephalitis, newborn kernicterus, prepubertal hypothyroidism. This all may make absent breast and present of uterus. طيب in the group 2 breast development present and uterus absent. طيب هذولا اللي هم the same as here. it's androgen insensitivity مثل تصغير feminization, Mullerian agenesis مثل اللي ذكرناه احنا او ال MRKH syndrome. Group 3 breast development absent but uterus is and uterus is absent, both are absent. وهذه عندنا اثنين لهم if both، وهذه تجي MCQ بكثرة. if both breast and uterus are absent it's something called 70-20. تمام. dysmolase deficiency. ان شاء الله تكون صحيحة الكتابة. وكمان واحد اسمه 17 alpha hydroxylase deficiency. يا رب. تمام. 17 alpha hydroxylase deficiency غالبا هذه تجي مع الميل. تمام. فتلاقينا 46 الكاريوتايب اكس واي. تمام. تكون هذه مع الميل. طيب الجروب الرابع الأخير حيكون both breast and uterus present. وهنا نروح على hypothalamic pituitary ovarian or uterine. تمام. Here what we care about is Mullerian agenesis. تمام. This is the correct answer. Let's go guys to the next. طيب nurse call you to check newborn, difficult to identify the sex. What is the most common cause? The most common cause simply is, as I mentioned here, it is congenital adrenal hyperplasia. The clinical presentation usually clinical severity depend on the degree of 21 hydroxylase deficiency. تمام. good genotype and phenotype correlation. عندنا نوعين classic. قلنا classic congenital adrenal hyperplasia. classic حيكون عندنا simple virilization and salt wasting. فيكون عندنا ambiguous genitalia of female and some dehydration, vomiting and diarrhea. تمام. In non-classic, it's milder than classic, and androgen excess can cause precocious puberty in either sex. Male are often underdiagnosed and asymptomatic. Okay. طيب. Let's go to the next. Okay. Female after delivery had severe postpartum hemorrhage and received oxytocin, misoprostol, methergine, and 3 doses of carboprost. She developed fever, feel flush, blood pressure is high, and some loose motion. Side effects. Which symptoms is mostly affected by prostaglandin? F2, it is a flush. Okay. I need to tell you guys here, all mentioned are side effects of prostaglandin F2 alpha اللي هو الهيمابيت carboprost, but flushing the most specific for this medication. Anyway, what do you need to know about this medication? ايش يهمك تعرف؟ ممكن يجيك as MCQ in this medication. carboprost. It is synthetic prostaglandin. ما هو semi-synthetic ولا هو natural. It's synthetic. تمام. prostaglandin F2 alpha which enhance uterine contractility وسبب بنفس الوقت and cause vasoconstriction. الدوز حقته هو اي ام طبعا 250 مايكرو جرام. if needed it can be repeated من 15 الى 90 دقيقه. الماكسيموم حقه 2 جرام او 8 دوزز. تمام. in 75% of cases a successful clinical response is reached within 30 minutes يعني 2 doses. Clinical response may be enhanced with concomitant use of oxytocin. The side effects include nausea, vomiting, diarrhea, bronchospasm, and hypertension, and many of the cases present with flush or hot flush. The recommendation is that the drug be given with caution to the patient اللي عندهم hepatic and cardiovascular diseases، اللي عندهم أزمة، واللي عندهم hypersensitivity to this medication. Okay, so the answer here is flush. طيب, next one. Male, active sexual with multiple relation now, with positive HIV, with previous sex disease. Ask doctor to do not tell his wife about her diagnosis. The best action of the doctor is tell wife direct, tell mother of wife to tell her, do not inform wife and keep it as patient confidentiality, tell assist to inform the wife. صراحة هذه من بعض الديزاسترز الموجودة. still it is vague. يعني the patient confidentiality, I have not to tell anybody about his or her condition. تمام. And if I did this, I will break the confidentiality. And I was in a community like of Western community, I may be uh, suited. طيب. كمان من الجهة الثانية, if I tell the wife, I'll protect her. تمام. So what should we do? Here we have four position. Position one, current counseling practice. Respecting patient autonomy is that benchmark of counseling. أقول له, we know that happened and it's not your fault, and we need to tell her so we can give her the medication that may decrease the risk of having HIV. Okay, the second one, current counseling practice. While safeguarding patient autonomy, patients should be encouraged to disclose their status to their partner for family benefits. لذلك, we will suggest him to sit together and inform the partner. طيب. In position 3, protecting patient's sexual partner at risk is essential by counselor should be legally protected. Even we need a counselor, not us, somebody who sit between them and try to convince the wife to inform the husband. طيب. Next, HIV should be regarded as a chronic disease. Testing and disclosure should be made routinely. So, our aim is do not inform anybody and respect the patient confidentiality and help her with the counselor with every method available to tell the partner about her condition and protect the partner. Okay, so the answer here is do not inform the wife. Type. Next is RBC agglutination test. This is very simple. It's IgM. تمام. And this is called heme agglutination. If an agglutination reactive involve red blood cell مثل ABO typing, one of the world most frequent use amino acid, it's IgM, usually performed at room temperature. If it occur at cold temperature, it's called IgG. تمام. In hot or normal weather, it is IgM. Okay, type. Let's move to the next. Type. Normal vaginal discharge. What do you know about vaginal discharge? Is it green? pH 5.5? Is it containing white blood cell count or corpuscle? It has cell with multiple nuclei? No, all are incorrect. The correct answer is pH 5.5. تمام. أتكلم سريع عن كل واحد منهم. الأمراض. الترايكومونياسيس مثلا هو تقريبا يمثل 10% من الأمراض. It's caused by Trichomonas vaginalis, sexual transmitted. وعندنا هنا vaginal discharge odor green elevated pH هيكون elevated pH مرتفع. اما bacterial vaginosis هذه ما هي inflammation, it's account about 30% of the cases, it's overgrowth mostly of the normal vaginal flora, تمام, and depletion of productive lactobacillus, تمام. Usually there is an odor, vaginal discharge and elevated pH. آخر واحد الكانديدا وهذا اللي يهمني, it's normal pH, بينما البكتيريا vaginosis والترايكومونياسيس high pH alkaline area. الكانديدا فاجيناليس هو طبعا ينشاف هايفي and pseudo hyphae, تمام. هو يعتبر yeast infection و it has two types, candida albicans and candida galberta أو galbrata, تمام. And it is not considered an STD. الغالب usually present with itching, severe itching, irritation, تمام, and normal pH. Okay, this is what you should know. Anyway, false positive nitrazine tests associated with vaginal bleeding, candida infection, urine leak, and cervical secretion. I pick here vaginal bleeding because in nitrazine test the pH of the vaginal secretion is generally تقريبا هي من 4.5 إلى 6, whereas amniotic fluid usually من 7 إلى 7.3. False positive result may occur in the presence of blood, تمام, مثل vaginal bleeding, semen, تمام, alkaline antiseptic, or bacterial vaginosis, not candida infection, or even maybe trichomonas vaginalis. False negative results, it may occur with prolonged leakage and minimal residual of fluid. تمام. Urine leak, many authors said it is also associated with false positive, but no, vaginal bleeding is more precise and more likely to be the correct answer here. Okay. Next one, 65-year-old menopause has rectocele. Common cause of weakness is pelvic pattern fascia, uterosacral, cardiac, or anal sphincter. طبعا the answer here is pelvic fat fascia. The cause of rectocele occur when the fascia between the rectum and the vagina is weakened, thus allowing the rectum to fall down, or allow the rectum front wall to bulge into the vagina. Some women may develop the condition during childbirth. Other processes, the placenta pressure on the fascia can also lead to rectocele. Types, typically the condition occur after menopause, during which estrogen is decreased. Okay, طيب. Next one, pain sensory of uterus come through round uterosacral, uterovesical, answer here uterosacral. طيب, what is it? It is pelvic splanchnic plexus or nerve. The uterovaginal plexus subdivided of inferior hypogastric plexus to sympathetic, parasympathetic, and visceral afferent to and from the uterus. الsympathetic هي lower lumbar spinal cord segment via lumbar splanchnic nerve and intermediate plexus. الباراسمباثيك هي pelvic splanchnic nerve. فعندنا السمباثيك اللي هي lumbar splanchnic nerve والباراسمباثيك pelvic splanchnic nerve. اثنينهم جايين من اليوتيروساكرال ligament, and this in such condition like chronic pelvic pain, endometriosis not responding to treatment, what you have to do is to do a transection at the localization of maximum number of nerve fiber transected, because of fiber disappear as they pass along the uterosacral ligament. تمام. So it is the uterosacral ligament. This is it. Next question. Okay, here they mentioned picture of open surgery with retractor, guys. Okay, it's an open surgery and they say a prolonged gynecological surgery remove mass. Patient post-op complaint of upper, وركز هنا, upper lateral thigh pain and numbness. Upper lateral. Most effective nerve. Which one of this? It is the lateral cutaneous femoral. So what you need to know here is this table is very important. تمام. The lateral femoral cutaneous, this one usually numbness on the lateral thigh paresthesia, and this is occurred by the compression with retractor injury to nerve with energy device. أو with this is rare to be occur with energy device أو tractor mainly طبعا. طيب الاليو هايبوجاستريك هذه entrapment cutting suture وغالبا هذه sharp cutting pain burning pain تمام. numbness burning and upper labia هذه ما دام ذكروا الupper labia and thigh usually this is genitofemoral وغالبا هذه incision or tear of the nerve by retractor compression. الابتريتور ونركز في الابتريتور هو النبنس اوف انتيرو ميديال ثاي عكس تماما الليترال فيمورال كوتينيوس تمام. ويكنس عندنا ضعف في المصل with external rotation والدكتور ويكنس هذه تجي بسبب التي بي تي direct injury of cutting clamping suturing needle injury التي بي تي. that's it. الفيمورال تمام هذه numbness also of anterior medial thigh عشان كذا اللاترال thigh هو الواحد اللاترال femoral cutaneous ومع weakness also. لكن هنا compression by the inguinal ligament by retractor أو قليلا ما يحدث as a direct injury. الباتوكس pain هذه باللامبو sacral trunk sciatic تمام. وهذه posterior اذا الوحيد اللي عندنا posterior هو اللامبوساكرال ترانك والسياتيك تمام مع النمنس وفوت دروب فيها موفمنتس. وهذه الفيمورال انتيروميديال الابتريتور انتيروميديال جلد فيمورال ابر ليبيا وهذه ليترال ثاي تمام. وهذه ان جنرال هو شيرب كاتنج على الابدومينال وول لاير. اوكي يا رب تكونوا فاهمينها. طيب آخر سؤال female with severe postpartum hemorrhage you مدري إيش internal iliac artery ligation of the following still patent. I don't know what is this. Let me correct it guys. Okay, now it is fixed. A female with severe postpartum hemorrhage undergo internal iliac artery ligation. Which of the following still patent? Guys, sorry, I will stop that again. Pause. Okay, so what should occur here is um, uh, you need to know that iliolumbar, superior visceral or uterine artery, which one, all are involved in the internal iliac artery, and the superior rectal artery is a branch of inferior mesenteric artery. So this is what you should know, that the superior rectal is branch of inferior mesenteric artery. تمام. طيب you know this is the external. I'll try zoom this one good. This is the external, and here where is ureter coming above, and the superior hypogastric plexus is above them, and this is the external iliac, this is the internal iliac, and it has, this is the anterior division and this is the posterior division. In the posterior division there is iliolumbar, lateral sacral, and superior طبعا superior gluteal. طيب in the anterior compartment, we have the superior vesicle, the inferior vesicle, obturator, middle rector, uterine, internal pudendal also, and inferior gluteal. تمام؟ تفاصيل مثل ما احنا شايفين في الصورة هذه. Please guys, take a picture. You need to know all of them. At least, what is the anterior? What is the posterior? Iliolumbar, lateral sacral, superior gluteal. Those are the posterior, تمام. And they cross through greater sciatic foramen مرة مهتمين, and the obturator cross through obturator foramen, and the internal pudendal crossing through ischial spine, greater sciatic بدل ischial spine بدل lesser sciatic foramen مثل ما احنا شايفين هنا, ويتوزع على الفاجينا الفالفا and some part of the vagina. تمام. هذه هي الصورة باختصار. أتمنى أنكم تكونوا فهمتمها. We reach the end of this session inshallah, and we will start other session very soon, guys. Please work hard in silence and let your success be your noise. هذا ما عندي، سامحوني على الأخطاء. السلام عليكم ورحمة الله وبركاته.